Welcome back to Dow Chiropractic and Acupuncture, and now we are in our rehab area, and I want to show you some quick tips and tricks that you can do to reduce your knee pain fast. So the first thing I'm going to talk about is how to use ice and heat. Now I follow the Chinese medicine approach when using ice and heat. They really don't like to use ice at all. So for example, if you feel your knees and your knees feel cold, then definitely you don't want to use ice, then you want to be using heat for that. Ice in general decreases blood flow. The knees don't get very good blood flow at all to begin with. When you decrease the blood flow, you actually slow down the rate of healing, and it might make it reach the point where your knees are not going to heal very well. So heat is a better way to go. When you put heat or ice on there, you're only going to go for about 20 minutes, and then you're going to put your hot pack away or your ice pack in the freezer, and then let it cool back off again, and then you can use it again in about 30 to 40 minutes, and you can repeat that as much as you need to. But in general, what you want to do is try to avoid the ice. That being said, if you're in a lot of pain and your knees feel warm, then ice might actually be a good thing to do to help reduce that pain, maybe reduce the swelling, and that might be what you want to do in that situation. Next, what I'm going to do is I'm going to show you some self-massage techniques that you can do that feel really good and that can help with relieve some of that knee pain. All right, so for our self-massage techniques, I'm going to show you some acupressure points that you can do, and I'm going to show you how you can use a tool. It's a lacrosse ball. You can use a tennis ball or a racquetball or anything else like that to kind of get the same effect. But first, let me show you some of these points you can use and check around your knee. But when you do these points, you're only going to hold the point usually for about 8 to 10 seconds. Definitely you don't want to hold the point longer than, say, 30 seconds. That pressure on the muscle can cut off the blood flow and lead to a buildup of lactic acid, which actually can make things worse over time. So if you find a sore spot, you can work on it a little bit, go to another area, work on that for a while, and then you can come back and work on that area after it's had a chance to get some blood flow. But let me show you how to do some of these acupressure points. All right, so now what we want to do is we want to feel for some tender spots around the knee. One of the best ones is if you feel along the bone, kind of feel up the knee, you might feel some tender spots in there. You're going to get to a spot where you feel a kind of a bulge in the bone right in there. That is a really great acupressure point, and that can be real tender. You want the pressure to be around a 6 to an 8 out of 10 pain. If you go up to a 9 or a 10, that's too much. You're not going to be able to relax. If you're below a 6, it's not enough pressure to stimulate the reflexes to make the tissues relax. So we want to hold that pressure for about a little bit less than 30 seconds. Then we can move on and look for other areas. Another great area is if we look at this big muscle right in here, right in the middle of the belly of that muscle, you may feel around for a tender spot. And if you find one there, you can get in there with your finger and kind of work on that. You can feel around, usually around these tendons. You might find some tender spots down in there. You can get in there and work those points. Sometimes on the side of the knee over here, around our lateral collateral ligaments, you might find some tender spots. Another thing you can do is use a lacrosse ball like this. And what you want to do with this is you're going to relax your hand, and you're going to use that to get in there and kind of pound on the tissues and really just sort of like tenderize that area and get the blood flowing and try to relax those muscles. Usually there's good points kind of along the inside of the leg, kind of down in here, maybe in the shin. A lot of people, their shins are really tight. This can be a great one. Just kind of get in there and pound on that area. On the IT band on the side of the leg, or even on the muscle here on the top. Just look for tender spots, and that's a great thing that you can do at home. We're going to show you one more exercise here. The last exercise I want to show you is the one leg balance test. Researchers have been showing this is like one of the best exercises that's out there. This can be good for the low back, it can be good for the knee, it can be good for the ankle. It's actually good for the brain, stimulates brain activity. It's good for lots of things. But let's say that her right knee is a problem. What she's going to want to do, and this might seem kind of counterintuitive to you, but she's going to stand on her right leg and have her hands against the wall. Okay. She's going to close her eyes. She's going to have a slight bend in her knee,
and her weight is going to be a little bit more onto the toes and the front of the foot rather than more by the heel. And with her eyes closed, she's going to work on maintaining her balance here. You're going to do this exercise for 30 seconds, maybe to 2 minutes, to increase the challenge, which actually makes this more effective. The more unstable it is, the more her stabilizers have to work. So we want to make this more challenging for your balance, but at the same time, be careful not to fall. She's going to bring her hands closer together and try to make it more and more challenging. Now she actually is pretty good at this. She can probably get down to one finger and just hold one finger against the wall in order to keep her balance. And again, she's going to work on maintaining this position. Because it's so unstable, it's going to force the stabilizing muscles around the knee to contract and actually hold the knee in place. People that have ligament damage in the joint are going to need to use those stabilizing muscles to hold everything in place. This may be a great exercise for you to do. Stay tuned for our next videos where we're going to show you how to use different techniques to correct the knee problems. We can get the pressure off the nerves, keep the pressure off the nerves, find the cause of the problem, which actually can relate to the lower back, and even use regenerative medicine and stem cell therapy techniques to regenerate cartilage that's been lost in the knee and just restore the function so that you never have to worry about drugs or surgery.